Hey everyone, and welcome. With American Heart Month here, we're going to talk about a health connection that honestly, way too many people just don't know about. We're talking about the really powerful and sometimes dangerous link between how you sleep and your heart health. So, let me just ask you, does this sound familiar? You snore so loudly you wake up your partner, or maybe even yourself. Or you wake up every single morning feeling just completely drained, even though you were in bed for a solid 8 hours. These things aren't just little quirks. They could actually be really important signals your body is sending you. Because the truth is, this whole thing, it goes way beyond just feeling tired. We're talking about a serious medical condition here, one with very real, very long-term consequences for your heart. What's happening while you're asleep could be quietly doing some serious damage. All right, so let's pull back the curtain on this hidden connection. We're going to explore exactly how a super common sleep disorder can basically act like a silent threat to your heart night after night after night. Okay, so to really get a grip on the risk, we have to start at the beginning. What are we even talking about when we say sleep apnea? What is it? So it's a condition where you literally stop breathing in your sleep. And the key thing to understand here is just how often this happens. We're not talking about it happening once or twice. Imagine your breathing stopping and then restarting dozens, or in really severe cases, hundreds of times every single night. That's what sleep apnea is. And this breaks down that nightly cycle of stress perfectly. So picture this. First, your airway collapses, it gets blocked, then you stop breathing. Because of that, your oxygen levels in your blood start to drop, a lot. And your brain, well, it freaks out. It senses a life or death situation and sends out this emergency panic signal. It basically jolts you awake just enough so you can gasp for air. And this happens over and over and over again all night long, even if you don't remember any of it in the morning. So you have to wonder, right? What does this constant state of emergency, this nonstop cycle of stress, what is that actually doing to your heart? Well, here's the damage report. Every single time your oxygen levels crash, your body is put under this incredible strain. This is what leads to higher blood pressure, it causes inflammation in your arteries, and it can make your heartbeat go all over the place. Over time, it's kind of like you're forcing your heart to run a marathon every single night. And that, of course, seriously raises your risk for major problems like heart attacks and strokes. And the difference is just, it's black and white. On one side, you've got healthy sleep. This is a time for your body to rest and repair itself. Your blood pressure is stable, stress hormones are low. But then look at the other side, sleep with apnea. It's a nightly battlefield. Your blood pressure is spiking up and down constantly, your heart rate is irregular, and your system is just flooded with stress hormones that damage your blood vessels. I know what some of you might be thinking. Come on, can a sleep problem really be that serious? Can it really hurt my heart? It's a totally fair question. A lot of people are shocked when they find out the thing they just wrote off as bad snoring could be a major cause of their heart condition. And the answer, from all the research, is a huge, unambiguous yes. This isn't just a guess. The data shows again and again that if you leave sleep apnea untreated, you are putting yourself at a much, much higher risk for a whole list of really scary cardiovascular diseases. Okay, so that was the bad news. I know, it's a lot. But the good news, the really good news, is that this is treatable. So let's talk about the solution. Let's talk about how the gold standard treatment, CPAP therapy, actually protects your heart. The best way to think about it is like this. CPAP, which just stands for continuous positive airway pressure, it's a machine that gives you a gentle, steady stream of air all night. And that air keeps your airway open. It's literally like a protective shield, preventing it from ever collapsing in the first place. It stops that whole vicious cycle of stress before it can even start. And when you use it consistently, wow, the results are just incredible. You're not just getting better sleep, though that's amazing. You are actively lowering your blood pressure, you're making your heart rhythm more stable, and you're slashing your risk of a heart attack or a stroke. You are finally giving your heart that peaceful night of rest and repair that it's supposed to have. So if there's one thing to take away from all this, it's that this is in your control. You absolutely do not have to let this hidden threat sneak up on you and define your future. Look, the link between sleep apnea and heart disease is real. It's deep, but it does not have to be your story. Getting diagnosed and starting treatment can completely change the direction of your health. So the question is, are you ready to take that first step? And get this, that first step is so much easier now than it used to be. You don't always have to go to some sleep lab and get hooked up to a bunch of wires anymore. A lot of the time, you can get diagnosed simply and conveniently right from your own bed with an at-home sleep test kit. At the end of the day, it really all comes down to this one question. This isn't just about feeling less tired, as amazing as that is. This is about protecting the most important organ in your body for the long haul. It's about having a better quality of life. So you have to ask yourself, isn't a stronger heart worth a better night's sleep?